Right now, as you've probably heard, hospitals are under tremendous pressure, especially our emergency departments, with people presenting with many different types of conditions. But the added impact of increasing numbers of COVID infection and what we think will be increasing numbers of influenza infection will have a really significant effect. So everything we can do to help prevent these infections that can be preventable, such as vaccinations, masking, distancing, protecting those that are most vulnerable, will have a huge impact on the healthcare system overall. Myth: I'm over 60 years old and have underlying health conditions. I got my last dose of the COVID-19 vaccine in the spring. I haven't gotten it yet, so I think I'm protected from getting COVID-19. It is great that people have had their initial vaccination series, either 2 doses or 3 doses. That does provide good protection against severe illness. But what we've noticed is that over time, especially if at least 6 months have gone by without a vaccination or infection, that the immunity starts to dwindle. And if you're at higher risk for severe illness, such as older age, 60 or above, or have any other medical conditions, or any age with immunocompromised or a weakened immune system, you become vulnerable once again to more severe illness with COVID. And so it is recommended that individuals stay up to date with their boosters. Those that are very high risk, including those that are elderly or immunocompromised, should get their booster dose, their 4th dose, if they've already had 3, after even 3 months. Others are recommended to receive their booster dose after 6 months. And this protects not only against severe illness, but also against reinfection, which can help to prevent spreading it to others as well. Myth: I'm a healthy person, so I don't need to worry about the flu shot this season. So we think this year influenza will be back. It was gone for a couple of years, likely due to masking as well as social distancing and an intention to try and prevent the spread of COVID, which also prevented the spread of influenza. However, based on levels in the Southern Hemisphere that have already undergone their flu season and what we're seeing early in Ontario, we think influenza will be back at significant levels once again. We know that the flu shot works best in those that are young and healthy because the immune system is stronger. And in those individuals, even though you may not get severe illness from influenza, you're more likely to prevent getting infection and prevent spreading it to those that are more vulnerable. Myth: COVID-19 mask mandates have dropped, so I don't need to wear a mask anymore. COVID rates are on the rise, and they likely will continue to rise through this winter based on what we're seeing. Hospitalizations are also on the rise. We know that there's good evidence for masking for COVID, so if 2 people are wearing a medical mask and one of them has COVID, the likelihood of transmitting between those 2 people is very low. Myth: there's no treatment for COVID-19 infection. We've now had access to effective treatments for COVID-19 for quite some time. The trick with the treatments are that you need to be diagnosed early. So if you are at higher risk for severe illness, you may be eligible for treatment, but you need to have a diagnosis and start treatment within 5 days, preferably even earlier than 5 days for it to have effect. So if you've been exposed to COVID-19 and you know it and you have any symptoms, getting tested and then getting referred for treatment is recommended, and there can be an advantage to you. Same as that if you do have any symptoms, even without an exposure and are higher risk, getting tested if you're eligible for treatment and then getting referred for treatment can help to prevent severe illness and hospitalization.